Sorry, I've been talking on mute. So I said good afternoon, everyone, and welcome to our webinar. We are using 1 minute to just allow people joining in. I can see number of people still coming in. So let's just give them 1 minute, but feel free to use the chat to start introducing yourself. Let us know where you're dialing in from or viewing this from as we wait for other participants. Okay, we'll go ahead and start. Good morning, good afternoon, good evening from wherever you're watching this webinar from. Welcome to the third webinar. This is our third of a seven-part series on the interventions to prevent and respond to child sexual violence. My name is Lina Digolo from the Safe Futures Hub, where I work as a capacity strengthening specialist. And I'm delighted to be facilitating this session today. Very interesting session alongside quite passionate and experienced colleagues that I'll be introducing to you soon. Feel free to continue using the chat as people come in to introduce yourself. And before we start, I'll just take a few minutes to introduce the Safe Futures Hub for the benefit of those who are new to us. We are a joint initiative that brings together three organizations, Together for Girls, the We Protect Global Alliance, and Sexual Violence Research Initiative, better known as SVRI. And the hub was created a few years ago to strengthen evidence-informed actions to prevent specifically child sexual abuse. And we work globally, but with a particular focus in low and middle income countries. This webinar that we're having today, as I mentioned, is a seven-part series, which is really aligned to the INSPIRE strategies and focuses on it's aligned to one of our solutions, which was the evidence review, global evidence review that we did to try and bring together evidence on what works against to prevent child sexual violence. And feel free to look at this. It's up on our Knowledge Hub in our website. So today's session is focused on one of the INSPIRE strategy, which is in norms and values. And we're going to look at why this matters in preventing child sexual violence. We have four very interesting presentations, and their task today will be really to unpack what the evidence tells us, what implementation experience has taught us, and what challenges remain in this particular space. We'll also touch a bit on what is needed to strengthen prevention moving forward. So really brace yourself for interesting conversations and use the chat box, use the Q&A space to ask any question you have as we move along. And just before we begin, I'll just remind us some housekeeping rules, just to help us manage this webinar a bit smoothly. Remember to keep your microphones off when you're not speaking so that we hear all the interesting conversations. Use the chat box as much as you please to keep introducing yourself, telling us where you're from, and sharing any reflections or questions that you may ask. But preferably use the Q&A box, space, so that we can answer, the panelists can answer you live through the Q&A space function during the webinar. You'll have a chance at the end to also ask questions live as we move. Just a reminder that we're going to be recording this session, and the resources will be available after the webinar for your use later. So I'll quickly get into introducing our speakers. And we have a wonderful panel. Next slide, please. We have a wonderful panelist with us today, bringing expertise around research, implementation, and global advocacy on preventing violence against children, particularly with a focus on norms and values. First, we will have one presentation from Joanne Jaggi, who works with us at particularly at the Sexual Violence Research Initiative. Joanne is a researcher with a lot of experience in this area, and she will be presenting our findings from the evidence review that I mentioned earlier at the Safe Futures Hub. We have another speaker, Tavisha Gupta, who's a researcher and advocate working with as a senior director of research and evaluation and learning with Equimundo. And she'll share with us lessons from global work on engaging men and boys and transforming harmful norms with the vast work that they've done as an organization in this space. We then have Dr. Manji Mukanji, who's a Senior Director of Strategy at ARPAN, who will also speak about their implementation experience with a lot of work done in this space in India. And last but not least, we'll get some experience from the linear study, and this will be presented by Dr. Anna Maria Bulla from London School of Tropical Medicine. So that's the lineup we have for you today. Quite interesting and passionate ladies joining us today. I'll just hand over directly to Joanne, who will speak to us and give us the evidence before handing over to the team that will share their implementation experiences. Over to you, Dr. Joanne.
Thank you so much, Lina, for the introduction, and hello, everyone. And thank you so much also for joining us today. So this is really an important topic, and we're delighted to have you with us. So I'll be sharing an overview of evidence from the Building Safe Futures Evidence Review on how norms and values interventions help prevent childhood sexual violence. Next slide, please. So when we talk about childhood sexual violence, we're not only talking about individual behavior, we are talking also about the broader societal values, attitudes, and inequalities that shape what communities accept, tolerate, or remain silent about. And harmful norms such as victim blaming, rigid gender expectation, or the belief that children should not question adults can create environments where abuse is hidden and sustained. And at the same time, protective norms can help safeguard children. For example, norms that support gender equality, children's rights, and open communication. These can strengthen prevention and response efforts. And we also know that norms influence everyone within the ecosystem, be they children, caregivers, teachers, faith leaders, peers, and even the institutions that serve them. And they shape attitudes towards consent, disclosure, masculinity, power, and accountability. And one important issue is silence, because we know that in many communities, childhood sexual violence remains highly taboo. And challenging these taboos is essential because it can increase disclosure, it can increase reporting, and also help seeking. And the encouraging news that we have from the evidence is that community-wide change is possible. And today we'll be sharing interventions that have helped shape attitudes, reduced acceptance of violence, and strengthened prevention cultures, protection cultures. Next slide, please. So the review identified several common approaches used in norms and values interventions. And the first are small group programs for children and adolescents. So these are often facilitated discussions that address topics such as gender norms, consent, respectful relationships, and bystander behavior. And evidence suggests that these programs tend to work best when boys and girls are both engaged and when facilitators are well trained. And the second category includes media and technology campaigns using both traditional and digital media. And these approaches have been found useful to reach large audiences and help stimulate public discussion and create awareness. And the third category is sports-based interventions, which use sports and trusted coach relationships to teach children about their rights, confidence, healthy relationship, and positive masculinity. And what we find as common strategies across all these approaches are: one, changing harmful attitudes, reinforcing protective behaviors, and breaking taboos that prevent disclosure and reporting. Next slide, please. So what does the evidence tell us? The evidence tells us that the strongest evidence in the review relate to small group interventions for children and adolescents outside school settings. And these programs have showed promising results in improving gender equitable attitudes and increasing positive bystander behavior among young people. But the evidence is still less clear on whether these changes are sustained over time and whether they directly reduce childhood sexual violence. For media and technology campaigns, we find that the evidence is promising but still emerging, and the interventions appear effective in raising awareness and stimulating social change, but more research is needed in the long term on their long-term impact on violence prevention. And it's similar for sports-based interventions, which show moderate improvements in attitudes and self-efficacy, but we need more evidence to understand their direct impact on preventing childhood sexual violence. So overall, there is promise, but also important evidence that remain to understand whether they actually translate to behavior change beyond knowledge and attitudes change. Next slide, please. So I'll briefly share examples of interventions in each approach, starting with the small group interventions. And one example highlighted in the evidence review is the Growing Up Safe and Healthy program, or SAFE, which was implemented in Bangladesh. This program combined community awareness campaigns, referral systems, and interactive discussion sessions with women, girls, men, and boys over a 20-month period. And the program showed reductions in sexual intimate partner violence risk and improvements in gender equitable attitudes and bystander behavior. And a key lesson from SAFE was the importance of skilled facilitators and locally relevant participatory content, as well as the engagement of men and boys alongside women and girls. And another example is your Moment of Truth, or YMOT program, implemented in Kenya alongside the I Empower program for girls. So YMOT focused on positive masculinity, consent, emotions, and bystander skills for boys, while I Empower worked for girls. And later they had boys and girls together in a joint session. And the findings show improved gender equitable attitudes and stronger bystander behavior. Next slide, please. So the review also highlighted innovative media and technology approaches. And one example that will be shared in more depth by Dr. Bula is the linear radio drama intervention in Tanzania, which addressed age-disparate transactional sex through an edutainment format. And this program helped to improve gender equitable attitudes among girls, caregivers, and men, and encouraged girls to focus more strongly on education and future aspirations. And the last example in this category is the Happy Toto digital game in Tanzania, which was co-designed with parents, caregivers, and child experts to support child sexual abuse prevention education for young children and families. And what stood out here was the importance of co-design and cultural relevance. And parents reported increased confidence in discussing child sexual abuse prevention topics with children after engaging with this game. Next slide, please. So the review also examined sports-based programs, and we have Skill Streets in South Africa as an example of this, where female coaches combine sporting activities with discussions about rights, confidence, and resisting unwanted sexual activities. And participants reported improvements in confidence, self-efficacy, and knowledge of support services. But at the same time, the review reminds us that sports-based programs also require safeguarding measures because coaches and authority figures can themselves hold significant power over children. Next slide, please. So this next slide, please. So I'll just continue as we wait for the slide to change. So while these findings are indeed encouraging, so we also identified several important challenges. First, we all know that norms are deeply entrenched and programs may face backlash from individuals and institutions that benefit from existing power structures or perceive norms change as foreign or external interference. Also, context matters, and interventions that work well in one setting may not necessarily translate to success in another setting because of the cultural, economic, or political differences. And norms change takes time. But unfortunately, many programs operate within short funding cycles, yet we know that shifting deeply rooted beliefs often requires sustained engagement over years. And we also identified a few gaps. For example, there's still limited evidence from low and middle income countries at policy and systems levels, particularly. And we also found very little evidence on interventions addressing homophobic teasing or discrimination related to diverse sexual orientations, gender identities, gender expressions, and sex characteristics. And this is despite evidence linking these issues to broader patterns of violence. And finally, we know that many programs are multi-component, so it can be difficult to isolate which specific elements are driving change. Next slide, please. So to conclude, I'll briefly recap a few key lessons from the review. Please just send it. Okay. Yeah, first, engaging boys and men matters, but this should happen alongside girls and communities and not in isolation. Again, as I've shared before, trained and trusted facilitators are essential, and participatory approaches are most effective when our facilitators can create safe, reflective, and respectful spaces, particularly given the sensitivity of this topic. And the importance of building trust with communities before implementation cannot be overstated. And programs are more likely to succeed when communities feel ownership and when interventions are culturally responsive. And related to that is context shapes everything. So we cannot assume that intervention simply can be transferred from one setting to another without adaptation. And as I've said before, norms change requires long-term commitment, resources, and community buy-in. And finally, we need stronger longitudinal research to better understand whether changes in attitudes as knowledge, which seems to be a key result of these interventions, ultimately leads to sustained behavior change and reductions in childhood sexual violence. So thank you so much for listening, and I look forward to the discussions from both the other speakers and participants. And I'll pass it on to Anna Maria Bula to share insights from the linear study. Thank you.
Thank you very much, Joanne. Okay, I'm going to share my slides. And are you confirmed you can see my slides? Can you see them? Perfect. Wonderful. Well, hello, everyone. Good morning, good afternoon, or good evening from wherever you are joining us today. For me, it's the afternoon. I'm very pleased to be presenting to you today some insights from the linear intervention, and you have already heard a bit about it from Joanne. Thank you, Joanne, for introducing us and for summarizing so well what the linear intervention is about. And hopefully I'm going to pique your curiosity by telling you a bit more, some more details about it. So the linear intervention, or linear, stands for the Learning Initiative on Norms and Exploitation of Adolescents. And it was born from the desire to understand, and this is, I'm talking 10 years ago, the desire to understand what was the role of social norms in driving sexual exploitation of children and adolescents. And so two things I would like to share with you is that my presentation focuses mostly on adolescent girls. That's like our sort of focus population. We are aiming to prevent the sexual exploitation of adolescent girls. However, as you will see, we engage the whole community and men in our work. But so a lot of the norms I'm going to share with you are mostly for adolescent girls. And I make this distinction because many of the norms we're going to see change a bit depending if the victim is a child, or it's considered a child, or it's considered an adolescent girl. In particular, when we're thinking about stigmatization and who do we blame for these events. So for those of you that are not familiar with the terminology of age-disparate transactional sex, transactional sex is defined as non-commercial and marital sexual relationships motivated by the implicit assumption that sex will be exchanged for material support or other benefit. And we call it age disparate when it occurs between an adolescent girl under 18 years old and adult men that are more than 5 years older than them. The reason why we decided to focus on this particular behavior, this particular manifestation of gender-based violence or sexual exploitation of adolescents, it's because the deep impacts it has, and not just at health level, but also at developmental and social developmental level of girls. We know that the lifetime prevalence of transactional sex, in particular in sub-Saharan Africa, is quite high. However, it's prevalent across the world. And actually, some of the studies we did at the beginning of the whole of Linea initiative were in Brazil, and so not just in sub-Saharan Africa. Age-disparate transactional sex contributes to gendered health inequities, such as early and unwanted pregnancy, and also lower educational attainment, and sometimes even dropping school. And because of certain laws and norms, sometimes this means that girls, even after having their children, cannot go back to school and finalize their education. ADTS is also associated with sexual, physical, and emotional violence, according to the VAC survey. And we do know that girls and young men and young women that engage in an ADTS are 3 times more likely than men to be affected by HIV, in particular in the sub-Saharan Africa region. So, aiming to knowing this sort of universe of evidence around ADTS, we started to look at the evidence on what was out there to prevent ADTS, and we found that a lot of the literature was actually, its main concern was HIV and preventing HIV, and ADTS was like a secondary outcome measured for some of the HIV interventions, but there wasn't anything that had been developed specifically for the behavior, and this is where our niche was. And we, after conducting formative research, we developed the interventions we are going to be discussing today. We co-developed them with Amani Girls Organization, which is a local NGO, Media for Development International, and the feasibility and acceptability was tested in Tanzania by Tanzanians and for Tanzanians. So the cultural relevance Joan was mentioning has been fundamental in developing Linea. And actually, Amani Girls, who are the co-owners of the intervention, are adapting it now in the country and working closely with the Ministry of Health and to adapt Linea for other regions in the country. Before I mentioned formative research, so before we started developing the intervention, we conducted a global systematic review on what norms underpin sexual exploitation. And I'm not going to bore you with the details. There's a brief and you can see the links. I think they are going to be shared. But I wanted to share mostly that 2 things. One, that this was a global review, and it was incredible how much overlap there was in the basic norms underpinning sexual exploitation of children across regions and across the world. And I want to highlight 2 of them. Stigma and discrimination against children and adolescents who experience SECA, that was found across the board, and lack of social sanctions for SECA perpetrators. But we also identify attitudes and factual beliefs that underpin the norms. And one that I want to highlight for you today is that this idea and this belief that girls are ready to have sex once they look like a woman. So no matter how old they are, but if they look like a woman, there seems to be this assumption that they are women and they are psychologically and developmentally ready to engage in sexual relationships. With all this information and with all the formative research we conducted, we went ahead and started a process of developing the intervention. And we landed in a complex intervention with 2 different components. A curricular component, and for this, we designed a curricula for men specifically, and a curricula for women specifically, for girls, sorry, specifically. And they have some areas that are quite similar, but also areas that were developed specifically with the needs and the developmental stage of girls in mind, and the length of the sessions is different, etc. And the other component is the radio drama, which I'm going to talk a bit more about in a bit. The main values or the main drivers of the interventions were that it had to be gender synchronized, so working with the girls, but also with the men that are on the other side of the equation. Evidence-based, because we had conducted research and the systematic review. Gender transformative, we didn't want only to stay at the level of knowledge and practices. We really want to challenge the gender expectations and norms at the base of the behavior. co-developed with Tanzanians, and feasibility tested. So before we went on to really implementing, we tested it with the community, as I mentioned before. I'm going to explain a bit more about the radio drama really quickly. So our radio drama is called Misishina Wakati, which means in Swahili and in English means the girl in the middle. The main characters of the story revolves around Amali, who's a 13-year-old girl who has to navigate family, schools, and friends' pressures and different situations. Her own sister is now pregnant and because of ADTS with a teacher at school. And she's being tempted into ADTS by a Boda Boda driver because she has to walk long distances to school. And at the end of the story, she learns how to avoid the temptations of ADTS, but not without having been almost tempted. And she has people in the community that helps her, and also her family sort of shifts from blaming her in a way to really understand her and support her. The other side of the coin is Tuma, who's a 20-year-old Boda Boda motorcycle taxi driver who faces his own challenges to his masculinity, to his availability to provide. He doesn't have a motorcycle, he's in financial strain, and he's feeling really down and challenged. And he faces pressure to engage in ADTS to sort of prove his masculinity, and because there's a lot of peer pressure. But in the end, he realizes that ADTS could also negatively impact him. So this is the background of the intervention. But I wanted to delve deep, or do a deep dive into 3 questions that our organizers posed for us today. And I'm going to give you examples of what we saw with the evaluation to answer them. So the first one is, what is one harm norm that enables childhood sexual violence, and what does evidence or practice show is an effective way to shift it? The second question I'm going to answer is, what is one approach that has successfully changed attitudes or beliefs around protecting children, and why did it work? And the third one is, if you could change one belief that communities hold about childhood sexual violence, what would it be, and what does research or experience suggest help change it? So regarding the first one, we found that, sorry, that's my timer, that sexually exploited girls are stigmatized, and at the same time, perpetrators are socially tolerated based on gender expectations. So to us, that was one of the key harmful norms. And our findings suggest that effective interventions should consider how individual, but also social and structural factors interrelate to perpetrate the issue. An example of our data, once this mother, 39-year-old mother, was exposed to the intervention. So in baseline, this is what she said before she had been exposed. She said, ADTS happens because of greed. The girls crave good things, which is why they find someone to give them, and they have to take it. After being exposed, she said, when a man who provided gifts asked a girl to have sex with him, because of a young girl has no ability to defend herself, then the only solution for her is to provide sex just because of the gifts. So the shift to an empathetic understanding, a sympathetic understanding of the situation of the girl, it's clear. The second question is, what is the approach that has successfully changed attitudes or belief, and why did it work? For us, edutainment was a strategy that really helped us in 3 different ways. It helped increase understanding of gender power inequalities. It decreased stigma and victim blaming attitudes, and it increased collective responsibility to protect girls. This was done through 4 main mechanisms. The existing protective norms in the community were highlighted. So it's not bringing new norms to the community, imposing new norms, but working with norms that exist in the community that they already have and highlight them. The harmful norms in this way get challenged. The protective behaviors are modeled through characters or storylines that model how people, like anyone in the community, can change. And the radio drama characters and storylines are used as a starting point to discuss ADTS. So an example here, the entire community has the responsibility of helping girls. The responsibility is not for women only. We also need men efforts. So this participant highlights it's not just mothers in charge of raising our girls, men should also be responsible. Everyone in the community should play a role. This girl, age 15, explained how she discussed the content of the radio drama with neighbors to educate them. And she said that she used the discussions, the radio drama, as reference to counsel the friend about it. So she chose very pragmatic examples of things that could happen, and that was useful for her to help her friends. Another girl said, I am now different compared to the time before I listened to the radio drama. I am now able to say no to older men or report to parents or teachers when they threaten me. And finally, my favorite question, because it's my favorite finding, I think, if I could change one belief that communities hold about childhood sexual violence, I would mention this one we found. There's a saying in Kiswahili in Tanzania that says, it translates to, the child of your fellow is your child. And this is a traditional way of looking at how the community raises a child. But a lot of people feel like with modernization and leaving the village, this has been lost. And people now only look at their children and don't consider other children like theirs. In the story, we had a middle-aged woman that challenged that reminded everyone that every child is your child and we are all responsible. And she helps girls to see this. And this was used as an example of how the characters on the radio drama had sort of made this norm that they already had salient in the community, and that changed minds. And this is an example. Even the neighbor's daughter is my daughter. I should help when needed. So this is all from me now. I just want to say that many of the things you said, Joanne, we are hoping the sort of the kind of gaps we have for edutainment, we're hoping to address with the randomized control trial we are conducting now. So now we are finalizing the trial where we have tested not just the radio drama, but the radio drama in conjunction with these two curriculums. And we hope we will be able to disentangle the differential impact of the radio drama versus the radio drama plus the curricula. And also we have a follow-up after the intervention and then 1 year after. So trying to get some longitudinal quantitative and qualitative data to see if the changes in norms translated into behavior changes as well. And thank you very much for your patience. And I'm going to leave you now with Tavishi Gupta and look forward to answer your questions.
Thank you, Anna, for that. That was really, really informative. And thank you to the Sexual Violence Research Initiative for the space. I'm going to just talk. So I hope you can all pay attention, even though there aren't slides to kind of root us. I work at Equimundo, Center for Masculinities and Social Justice, where we've been doing over 2 decades of research programming and partnership work that sits at the intersection of masculinities, violence prevention, and child protection. As we think about child sexual abuse, I want to frame my remarks in the idea that the evidence is clear that CSA is mostly perpetrated overwhelmingly by men, but the field is now slowly starting to recognize and apply a masculinities lens to think about why this occurs. Many of the risk factors that are often cited in the literature on child sexual abuse, like impulsivity, aggression, drinking, etc., are the same kind of harmful masculine norms, just with a different name that we know also drive other forms of violence. So, and the gender norms that often equate sort of manhood with sexual entitlement and control, Anna, you would just kind of also presented on that, contribute directly to male perpetration of sexual abuse against children, are also the forms of masculinity, unhealthy masculinity that often Equimundo tries to understand. So, what is the link between sort of even the child survivors of child sexual abuse and adult perpetration? And the reason I bring that up is because Equimundo has been doing this global survey called the International Men and Gender Equality Survey, IMAGES, which is now in over 50 countries with 75,000 men and women. It was particularly focused on sort of intimate partner violence. But what made it unique is trying to understand, like, what are the drivers of why men perpetrate violence? And across nearly every country we studied where we've conducted images, we find the same thing, that the single strongest predictor of an individual man's use of physical violence or sexual violence against a female partner is having witnessed violence against their own female caregiver in childhood. And in some settings, men who have witnessed violence in childhood are twice as likely to use it themselves as adults. And so this kind of pattern extends to sexual violence, where Lori Heisey at the Prevention Collaborative has found that this is witnessing violence and experiencing violence as a child is one of the most consistent risk factors for perpetration as an adult. So why I'm sharing this is because what we can take away from this is violence is learned, it is transmitted across generations, and therefore it can be interrupted. And the norms that I want to tap into around this intergenerational transmission of violence is this idea that when you experience or witness violence as a child, it is normalizing the larger ecosystem of violence in young people's minds and sort of their formative years in their communities, in their families as they grow up. So they become desensitized to such behavior. They end up kind of internalizing the gender norms that promote why and how this violence occurs. It blurs the lines between what is normal parenting and then what is abuse. And then that kind of leads to further abuse as adults. The other norm that I think is really important that Equimundo looks into is this norm of silence. And we know that for women and girls, the norm of silence that, you can't disclose whether or not you've been abused is very high. There's stigma around it. Our research is finding similarly that when boys and men tend to well, first of all, there aren't actually a lot of services that actually are designed to support young boys to be able to actually disclose violence, because often we only assume that sexual violence is something that's happening to girls and to young girls. And so also the norms around boyhood and manhood tend to kind of socialize boys to believe that vulnerability is weakness and that disclosing harm is shameful. I know there's colleagues from ECPAT in the audience, and they're also doing work on this topic. The fact that we raise boys in many cultures to absorb pain quietly, to see toughness as a part of their identity, and they don't have the language or the permission to be able to talk about what happened to them, recognizing again that the more we think about witnessing and experiencing violence as a child, we're also creating adults who are at risk of perpetrating violence. Um, you know, there's research in Afghanistan around the practice of bachabazi, which is essentially a cultural tradition where boys as young as 8 are even trafficked and sold. But often the international community or authorities tend to kind of ignore this as a practice of harm because it's seen as such a part of culture. And families are really worried and, concerned around disclosure as well, because again, this is so normalized. So when you have these kind of norms that are deeply embedded, how do we actually shift them? And so a lot of the programmatic work that we've done in sort of group education model settings points us towards the positive impact of gender transformative group education. We have a program called Program H, which is Program Hombre. It's been evaluated now through 10 quasi-experimental studies, randomized control trials. And what we found is that if we can create sort of structured spaces where young men can critically reflect on what they've been taught about manhood, they can practice new ways of relating and internalize different ideas about strength and vulnerability, there's a possibility of change. There is evidence that it has reduction in violence perpetration, increased help seeking by men, and greater openness in equitable relationships, again, by young men. The theory of change is that of progression, right? That you have critical reflection, you rehearse in safe group settings, and that helps you internalize new norms, and then you get to live them. One of the things that I want to do is also say, what's a positive kind of approach that we've actually learned? And I don't know how many of you have heard about this model called Bande Barejo in Rwanda. It's a parenting program. It's based on our Equimundo's program Key, and we do this in collaboration with the Rwandan Men's Resource Center, RAMREC. And this has been ongoing for 10 years, where men and women, and Joan, you brought this up, right? You have to engage men with making sure that we're talking about the women in their lives as well. So men and women in couple dyads are actually invited to 15 sessions. And we did a randomized control trial 6 years post-intervention. And what we found is that as a result of engaging in the Bande Parejo program, there's a 40% reduction in men's use of physical and sexual intimate partner violence against females, 15% reduction in parents' use of corporal punishment against their children, better couple communication, less dominance by men in household decision making, and more. So one of the reasons why we have identified as this program being very successful is that it met men where they were at a moment when they were becoming fathers, which is a really important transformational moment where they would be willing to accept change, where identity, of like being an equitable father is quite high. And it engaged them with honesty about how rigid masculinity is actually hurting them, their families as well. So until and unless we don't actually show men what is their stake in gender equality, it's going to be really hard to create that change. Just want to flag that since Bande Parejo has been launched, it's now been adopted as a national program by the Rwandan Ministry of Health, scaled up and reaching more than 10,000 additional parents. And this matters for child sexual violence prevention because when children are raised in safer households, when they're raised in households where people talk about caregiving, we're also more likely to create homes where children feel safe enough to speak. So let me sort of end by saying that we know what works: gender transformative parenting programs, community mobilization, trauma informed interventions. We know that they're all relatively small at scale. We also know that progress is stalling. So it's just a matter of now engaging in conversations and taking them more to sort of scale at national health, education, and social systems so that we can make prevention more ordinary rather than exceptional. I'll stop here. Let me pass it on to Manjir, who is going to share more about leadership insights in prevention work from around work and how do we shift attitudes and behaviors around CSA in India.
Thank you so much, Tavishi. Thank you so much for the presentation coming up. So as Tavishi already mentioned, I'll be speaking from an Indian context of a practitioner and what have we been doing on shifting norms. Before I start there, can we go to the next slide, please? So there are three questions that I would be setting out to kind of answer today. The first being, what are the key cultural norms and deeply held values that perpetuate sexual violence in India? How can these norms be addressed at scale based on our last 2 decades of work in India? And how have we been able to measure this in complex real world settings? The next slide. And while there are a number of norms, as it's already clear through the previous presentation, and Joanne making the first space about what are the norms which actually perpetuate and reinforce child sexual abuse, I would like to focus on 3 critical norms that we have really seen reinforcing child sexual violence in India. The first being the entire lack of conversation on anything related to sexuality and body safety, and which definitely then includes child sexual violence and creates a barrier towards any prevention efforts. The second being that children are taught not to question adults. I think that becomes part of a very cultural belief that adults are to be respected, irrespective, and that becomes difficult for children then to refuse or report abuse. And the third being that children are often held responsible for unsafe situations, which again discourage disclosure and support seeking. I think these are the 3 norms, and what kind of makes me pause here that these are the norms we also heard from other presenters from the other parts of the world, which means these are very key norms that shaping how we work on child sexual violence across the world and not maybe in a particular context. The next slide, please. So I'll focus on 2 interventions that ARPAN has been doing, and the first being the Person Safety Education Program, as we call it, which is an integrated school-based approach working with children of all genders, parents and caregivers, teachers, and the school system. And the focus here is definitely preventing childhood sexual violence by building children's agency and safety schools, skilling adults to initiate conversation, and which lies at the threshold of how are we being able to demystify the norms that this is a subject that can be spoken about in everyday conversation, and support healing of children who discloses about their sexual abuse experiences. Next slide. And the next that I would be speaking about is another intervention, which is Child Safety Week, which Arpan has started from 2019, which is a week-long mass campaign and a collaborative movement to bring different partners together, be it government, influencers, media, schools, everybody together to amplify conversation on child sexual abuse and encourage collective action. Next slide. And what we're trying to do these are two complementary pathways that then we are looking at. One, which is addressing norms through very deep programmatic interventions, and the other, which is happening and taking care of the breadth, because India being a country, I think both your depth and breadth needs to complement each other to make any dent in an issue like child sexual violence and non-social norms, which are so deep entrenched. For next slide, please. Coming back to person safety education and what we have been able to see in the last 2 decades of our work, I think the first challenge is to bring vocabulary to the space of child sexual violence, and even starting off with giving vocabulary to children on private parts. We have seen that children don't have a vocabulary, so whenever even they face an unsafe situation, they don't even know how to talk about it or whether to talk about it. And this has created challenges for them to identify, refuse, or even disclose unsafe behavior. We are bringing two structurally assessed comparison between two independent rural child data sets from urban intervention. And what we saw that at benchmarking, 18% of children hardly had a vocabulary of private body parts, because the conversation on even private parts is completely sidelined and is associated with a lot of shame and guilt. So while children learn about all of the body parts as early as when they're 3 years or 4 year old, there's no vocabulary for private body parts given to children by parents, by schools. So it's completely sidelined. Post-intervention, we have seen that 74% of children having that vocabulary and even the comfort to talk about it. Next slide, please. However, breaking and normalizing these conversations with children is one part of the story. The second part of the story is to work with the parents and caregivers, because a lot of shame is actually comes from how parents have been socialized and what they are then kind of continuing with it. And as Tavishka rightly said, that it's all about how parents are approaching the issue. And a very standard response from parents when we start off is whether this is at all necessary. What is this all about? And then moving to that, now I believe that children should learn this because it's happening everywhere. So I think that's the transformation in their shift in believing that this conversation is very necessary as talking about road safety to children. Post-intervention, we have seen 98% parents at least initiating conversations on person safety, at least acknowledging that this is an issue which is not out there, which is not about other children, other families, but it's actually about them. So that entire othering of the issue gets challenged when they kind of be part of this kind of intervention. The second evidence that we are looking at from Arpan's internal data point, that 10 years before, when we have approached schools on person safety education program, we have seen a 10 to 15% conversation ratio. And the challenge is it will rob children of their innocence. Children will start experimenting in the classroom. However, today we see 70 to 75% schools actually willing to agree on the program. And it's through their recommendation and words of mouth that they have seen the benefit of the program, because what they actually see when they go through the program, that it doesn't necessarily increase children's inappropriate behavior, but it actually classes become safer places for children, because sexual bullying actually comes down significantly because children now understand personal boundaries much better. The next slide. The second norm that I would like to kind of speak about, as I focused on, is this entire unquestioned obedience and respect. And at benchmarking, we saw that among adults, that 45% adults, parents felt that children should obey adults, irrespective, like they shouldn't be disobeying adults, even when adults make them uncomfortable. Like that's the space that we are coming from. Uh, Even children, it was only 12% children who actually believed that they can say no to an adult in an unsafe situation. Whereas after post intervention, we saw at least 94% children being able to believe that it's okay to say no. I think that in itself is a huge transformation where children realizes that we can say no to adults. I think coming from a culture which is deeply entrenched in being respectful of adults and completely unquestioning. Next slide, please. The third thing that I would like to kind of focus on is the entire space of victim blaming. As I said, as I think came out from earlier presentations as well, the responsibility that lies with the person causing the harm is always completely invisible. And like what gets the children are facing the blame because they might have done something to invite the abuse. I think that's another belief which completely shadows help-seeking behavior from children, because they know they are the one who would be blamed, or their benefits will be curtailed. They will be asked not to go out, not to use mobile. So it's they who would actually suffer from it. At benchmarking, we saw that 34% parents believe that CSA is never the child's fault, which kind of went to 60% post-intervention. But as you see, it's still at a 60% post-intervention. And this is an area that definitely needs much rigorous, continuous work, because it's a very deeply entrenched value that adults' relationships sometimes to adults are much more precious compared to how they need to kind of appear to children and kind of absorb them. However, we saw that children themselves, at least 76%, even before the intervention, understood that it is not a child's fault, and it increased to 97%. And children articulated that now they completely understand that it's not their fault, because it's not they who have kind of committed the harm. The next slide, please. Okay. This is about the person safety education program. The other stream that I was wanting to focus on is the child safety week, because what we're seeing through this kind of a mass campaign, which is increasing public engagement, that we have seen, and there are some signals of change, and we definitely need to understand this much better, because a large mass scale campaign to understand the impact of it also needs its own time. And what we've seen, at least partnership bases are kind of increasing by two-folds in the last 3 years. We have seen 33-fold increase in media coverage, and mainstream media, which has covered that child safety should not be a taboo subject, which would earlier really kind of creep on, kind of even taking any kind of reporting on child sexual abuse, has kind of spoken about it very strongly. What we also seen, and this is coming from a space that how accountability needs to be on the offenders, we have seen that post the Child Safety Week campaign, and the last two campaigns has largely focused on accountability on offenders, that adults now believe that offenders are accountable, and that there is the law can actually protect children. Earlier, there was that sense of accountability to offenders was completely absent. However, these are very initial signals of change, and there needs to be a lot more kind of continuous work on changing mass behavior, and actually kind of also examining it and doing research to kind of see how can it become more behavioral change. Because next slide, please. So just to kind of sum up the key learnings that we have had in the last 2 years, like last 20 years of our work, is that we need to invest in long-term layered interventions. I think short-term intervention, as Joanne also mentioned, will not really change the norms that is at the root cause of child sexual abuse violence. We definitely need to create much more safer and participatory spaces, and engage with community with empathy and respect, even when they differ, or when they even have a myth. Because if we come from a very top-down approach, we lose on people that we are working with. And what we have seen with parents, they are equally concerned about keeping children safe and their children safe, but it's the it's the family honor, it's their belief, it's the practices that kind of held them captive to those belief systems. So if we walk with them rather than walking over them, I think we see success. I think walking with children, adults, and systems simultaneously. In terms of evaluation, our understanding has been to measure attitudes and practices, because that actually gives you a glimpse of norm change happening, and combining both quantitative and qualitative methods, using more mixed method studies, as well as integrating practitioners' insights and research, and with evidence-based research, because I think practitioners' insights actually kind of strengthen the norm shifts that you witness when you're working in the field at the ground level. So with that, I will end my presentation. Happy to answer any question, and I would like to pass it to Lena.
Thank you so much, Manjer, and all the speakers who've spent the last few minutes really educating us on these quite interesting topics, for your thoughtful and quite insightful experiences. We have just a few minutes remaining to the webinar, and I want to just to quickly open up this to see if there's one burning question. Any one burning question? I know there's one has already come in and has been responded to. If you have any question to the speakers, this is your opportunity. So it looks like the speakers were very clear today. We've got a lot of feedback coming back, or some key things that we are learning from our norms and values, evidence from both research and practice, a lot of conversation around making sure we are investing in long-term interventions if we want to see change, building commitment with the communities that we are working with. We can't just go in. We have to start building those relationships and investing in training of the teams that are going to be delivering these interventions. Remember that context matters. So a lot of feedback that's coming back, and I think we have enough information within the slides, the webinar that will be shared. Thank you for joining us. Please take time to look at the resources that the presenters have shared with us. We will be sharing this with you in the next coming few days, and let's continue these conversations. We'll be having a follow-up webinar in the next 1 month that will be looking at the next Inspire strategy, which is response. So we look forward to you joining us again, and keep in touch. Keep talking to us through our email addresses and our knowledge hub at the Safe Futures Hub. We have a poll that's up. Please take some time, just a few minutes, to give us back your feedback so that we can continue improving these webinars as we keep moving on. Thank you so much for participating, and have a good evening.
Thanks, everybody.
Thank you.
Bye-bye.
Thank you.